When a patient comes in and we were starting a conventional denture, whether they had decent dentures or not, that was a 7-appointment sequence. There were no shortcuts. Other doctors might have gotten it down to 5, but if you do dentures in a quality manner, in the analog world, you scheduled 7 appointments. We do a lot of 2 and 3 appointment dentures for our AvaDent patients. It's completely changed how we think about dentistry. And I used to, for a while I felt a little like, wow, this is so easy. And no one complains about having 2 or 3 appointments versus 5 to 7 appointments. That's really valuable to those patients. And of course, it's productive to the practice. We can see chair time is what we have. And if we can do it more efficiently, we can be more productive.
AvaDent's definitely reduced costs overall because the fewer appointments, less chair time, less time taken up by doing denture repairs, less time taken up by doing denture adjustments, less time taken up by redoing a denture that a patient has lost. It's just all of those things added together. It's absolutely worth it.
AvaDent Digital Dentures has impacted my practice. It is what propelled me to open New Start Denture and Implant Partners. I would not have done a denture-focused practice at this point in my career without having a digital partner like AvaDent. It's the predictability of the outcome, the denture, the overdenture, the implant bridge. It fits every time. And that predictability in denture world did not exist before we had CAD/CAM come to dentures. And AvaDent's is the company, the group that introduced me to that. I've been out to the facility. I was amazed by the denture design. I was amazed by the milling processes that go on out there. To watch it, it's what propelled me to continue to practice and to, want to help more patients because it's predictable.
Implementing the digital workflow and working with AvaDent has really made our workflow so much easier, so much quicker, streamlined, more efficient, fewer appointments. It's just made life so much easier. The learning curve is pretty flat. I mean, if you don't know how to do a denture, doing a digital denture isn't going to automatically give you that knowledge. So you still have to know what you're doing, but if you're already skilled at doing a traditional denture, doing a digital denture is piece of cake. I mean, it really is a quick process, especially with AvaDent and the software that they use. It's very intuitive. Once you get set up in the portal and everything, it is just a breeze. It's a pleasure to do it. It takes dentures away from being a drudgery into a fun dental procedure.
The digital design is phenomenal in that you can make changes as you want without a laborious 4-hour reset by a technician in a lab. If you want to move things, change things, you have such freedom in design. What I've told a lot of people is the AvaDent design algorithm for occlusion is above anything else on the market. And a proper occlusion, the best occlusion, is what leads to a denture with very few adjustments. So you have a denture that fits really well, that requires very few adjustments. A denture with a perfect bite every time comes to us with a perfect bite because the algorithm designs it as such. It's phenomenal. Many, many fewer adjustments that you used to face with a conventional denture.
Yeah, we play with the software a little too much sometimes because it's so fun. It's so intuitive. It's easy to work with. We get back the basic setup. We look at that and say, yeah, we'd like to tweak it a little bit. And so we'll get in there and play with the size of the teeth. And it's so awesome to be able to have the freedom to change the length of the teeth or the width of the teeth and not be constrained to, okay, here's the size of the tooth because this is these are the teeth that you got on this certain cart of teeth that you ordered, and even though these are exactly the way I'd like them, man, I'd like these to be a little different. Well, too bad, you're stuck with those. But now we can change anything we'd like.
Digital denture is different, unique, 100% different than the way I had provided denture care before, in that the unpredictability of the lab processes in fabricating dentures was taken away. And so I now, whatever records I give AvaDent, I get back a great denture reflecting what I hope are great records. And that predictability is phenomenal. That's what makes denture care, this denture practice in particular, fun. Like, to be able to deliver exactly what you're prescribing, and that's what the digital fabrication method with AvaDent gives us. It's phenomenal. It has recharged my energy and actually led me to open New Start.
We've had patients to have traditional dentures, and we're making out fine with them. They come in and get new dentures. We do a digital denture and get a denture back from AvaDent. They put it in and say it fits like nothing they've had before. It makes a difference. My favorite thing about an AvaDent denture is the strength, I think. The exceptional fit is great, but those things are so strong, so dense that they don't break. They don't pick up stain as easily. They don't wear down as easily. We're going to get a denture that's going to be stable and functional for a much longer period of time. I love that.
So one of the things I say as I go out and talk about AvaDent and our denture process is it's digital, it's hot, it's exciting, but it doesn't change the need for good denture records. And dentures are hard. It's a dying art. That's one of the other reasons that Dr. Gray and I started New Start, is we have an experience that we bring to this that allows us to use the new technology, but input really, really good records to AvaDent. So if a doctor is considering going to AvaDent, you still have to understand what you're trying to create, which is a lower facial third. I mean, you're restoring from here to here. And that's a lot of parameters to get right. I think if a doctor is comfortable doing conventional dentures, they're going to love using AvaDent, because it's just a question of digitizing the data. And once it's digitized, it's predictable. There's a barrier to entry for this, and that is the digitization of the records. And I think that's AvaDent's challenge, is to make it easy. You know, we invested in a nice benchtop scanner. You can do this with intraoral scanners. You can digitize your records with intraoral scanners, but you still need great records to come in to get a great denture out.
When we're doing AvaDent denture, number one, it is predictable, so we know exactly what we're going to get back. And very often we can do a denture, do the records in one appointment and deliver at the next appointment. That again is just completely unheard of in the old way of doing things. It's just that predictable, and so that's tremendous savings for us. And again, we can see more patients, we can get more chair time freed up, but also it's great for the patients. We have yet to have a patient to come back and say, "What, you mean I don't have to come back for 5 appointments? Was this crazy?" They're not complaining about that. They like being able to get impressions, get a denture the very next appointment. Occasionally, if we have a patient that needs it, we can do try-ins. But again, that process is so streamlined and so much better. I think the biggest savings of chair time is post-operatively. When we bring patients back for adjustments, they're non-existent, because it's so accurate. What we're getting back from AvaDent is so accurate that at the post-operative appointments that we always schedule, because we don't want to leave our patients out there suffering with a sore spot or something like that. I so often have had patients come back in and say, "Yeah, I wouldn't have even come back in except I already had the appointment set up. I've got a little spot here, let's just take that down." But they're non-existent. Used to, we would spend 30 minutes, at an appointment post-operatively doing adjustments and stuff like that. It just doesn't happen. I mean, it is great. Again, great for the patients, great for us. It's a win-win.
When patients lose dentures, sadly all the time, nursing homes, hospitals, the dog, the cruise ship, the fishing expedition, it happens all the time. Sadly, in the old world, that was 7 appointments and trying to recreate what they had previously, and we had no hope of getting back to what they had previously. But we could make a good denture, but it wasn't likely to be the same. Now, we open up the AvaDent dashboard, we put in an order for a replacement denture, takes us 5 minutes. 2 to 3 days later, we have a denture in-house ready to deliver to that patient. That's an exact duplicate of the AvaDent denture we made for them 3 years ago. I did this for a patient that I had done in 2015. 8-year-old denture. I got the duplicate in 2 days. It was phenomenal. That's priceless. And frankly, it can be productive. You know, when we're able to deliver a denture with no chair time, and there is obviously a fee for that, and you know, patients do not complain about getting a brand new denture 8 years later that matches exactly what they had with 0 chair time.
When they come back in after they've had a denture that we've done digitally, they're able to go out to dinner and eat and not worry about their teeth moving around because they fit so well. Not worry about limiting, you know, what they eat and things like that. In our office, we have a big picture of a family around a dinner table, and we think that's what we ultimately want to help people with, is to get back to sitting around the table with your family, with your friends, and enjoying dinner and not worrying about, you know, your dentures, not worrying about your teeth. And I think we're able to accomplish that.